Dementia is not a discovery in the world, however. It is not a subject that many Nigerians are familiar with or understand well, because more than 40% of the population cannot read and write in Nigeria's official language, English. Though many people are suffering from dementia in Nigeria due to a high degree of illiteracy and poverty, understanding of the condition is limited, and people mistake dementia patients for witches and wicked people, or as a result of affliction by enemies with voodoo. They occasionally take some of the dementia sufferers to churches, sorcerers, herbalists, and traditional healers for relief from demonic attacks, which is not true and not right. The victims are frequently subjected to physical violence daily. Ironically, some of the pastors, herbalists, sorcerers, and clerics are suffering from dementia themselves, but because they are still partially functional, and because they have people working with them, they are shielded from the general public. They can mask it. Dementia is an umbrella term for a variety of degenerative brain disorders. Each type of dementia impairs the functioning of a person's brain cells, or neurons, in specific places, impairing their capacity to recall, think, and talk. Doctors commonly use the term dementia to describe symptoms that worsen with time, such as memory loss, confusion, and speech and understanding difficulties. Dementia can strike anyone at any age, but it is more common in those over 65. Dementia is divided into nearly 200 subcategories. Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia are the most frequent. By 2025, it is expected that over 1 million individuals in the UK will have been diagnosed with dementia, and almost everyone will know someone who suffers from it. How many people will be diagnosed with dementia in Nigeria during the same period if there are facilities and resources to carry out similar exercise? Most common types of dementia, Alzheimer's disease. In the United Kingdom, Alzheimer's disease is the most prevalent form of dementia. It is caused by an accumulation of proteins in the brain, which impairs the ability of brain cells to convey messages. Alzheimer's disease symptoms typically worsen over time. They include the following: inability to recall recent events, often retaining a good memory for past events, insufficient concentration, having difficulties recognizing individuals or objects, insufficient organizational abilities, confusion, disorientation, speech that is sluggish, confused, or repetitious, difficulties with daily activities such as cooking, paying bills, and shopping, and difficulties with decision-making. Alzheimer's disease has no cure. However, treatment can help halt its course. Dementia vasculara. The second most frequent type of dementia is vascular dementia. It is caused by issues with the brain's blood flow, most frequently as a result of strokes or mini-strokes, termed transient ischemic attacks, also known as TIAs. This results in areas of brain cell destruction. Changes in a person's state as a result of transient ischemic attacks or a larger stroke are frequently abrupt and eventually plateau or level off. However, the resulting damage frequently means that the individual will never perform quite the same way they did previously. Vascular injury can also occur in the brain's smaller vessels, known as small vessel disease, with symptoms being more gradual. The symptoms of vascular dementia are frequently comparable to those of Alzheimer's disease, including memory loss, confusion, and communication difficulties. Vascular dementia symptoms. Symptoms can depend on which area of the brain has been affected and may include specific problems with language reading, writing, walking, sudden changes in mood, and bladder control problems. Lewy body dementia. Lewy body dementia is a degenerative neurological disorder that impairs mobility and motor skills, which is the ability to control voluntary movements for specific tasks, like walking, getting dressed, and using cutlery. Memory loss is frequently less severe than in other types of dementia. A person suffering from dementia with Lewy bodies may be prone to falls, have tremors that are comparable to Parkinson's disease, and have sudden periods of confusion. They may also have difficulty swallowing and experience interrupted sleep patterns as a result of severe dreams or nightmares. Additionally, they may have auditory and visual hallucinations. When they walk, they shuffle. Frontotemporal dementia. Frontotemporal dementia affects the brain's frontal lobes, which control behavior, learning, personality, and emotions. It can affect persons of all ages, but it is more common in people between the ages of 45 and 65 than in those 65 and older. Frontotemporal dementia is notoriously difficult to diagnose. It is frequently confused with sadness, stress, anxiety, psychosis, and obsessive-compulsive disorder. Frontotemporal dementia can result in incorrect social behavior as well as a lack of inhibitions. People's eating habits can also be disrupted, with people suddenly binging on food, particularly sweet foods. Young onset dementia. Young onset dementia refers to any type of dementia that manifests symptoms before the age of 65. It is occasionally referred to as early onset dementia or working age dementia. Around 5% of patients with dementia are believed to have young onset dementia. Alzheimer's disease, vascular dementia, and frontotemporal dementia are the most frequent kinds of dementia in younger people. Parkinson's disease and Huntington's disease, which are rare and genetically inherited forms of dementia, are also more prevalent in younger people. Language, vision, behavior, and personality difficulties may be the initial signs rather than memory loss. This can result in a delay in diagnosis because the symptoms may be mistaken for those of depression, work stress, or relationship troubles. In conclusion, dementia is a condition that encompasses a variety of factors that result in challenges or issues with the human brain. It cannot be inflicted on anyone by anyone. It is a condition that necessitates the provision of care and resources for the individual's daily activities and professional endeavors, contingent upon the severity of their dementia. This determines the level of assistance they will need and the extent to which they are capable of self-care. Dementia still lacks a cure and continues to deteriorate over time. However, it can be slowed by the provision of adequate care and management by competent individuals who have been trained for the job. An accountability framework should be established, and systems should be in place to punish staff who abuse individuals living with dementia, including custodial sentences for the abuser, as is the case in the United Kingdom and other developed countries. The Nigerian government must take the initiative to establish a framework for the establishment of care facilities in Nigeria and to allocate funds to local governments to support the elderly and individuals living with dementia in their respective areas. The establishment of numerous care homes and the creation of numerous employment in each local government in Nigeria will occur if funds are made available to those who are impoverished and lack the resources which shall be provided by the government. A lot of health and social care jobs will be created, and the most vulnerable people in our society will be protected. Nigeria will not exist if there are no Nigerians. It is important to bear in mind that when the jungle matured, everyone becomes a commando. May Nigeria does not befall you in this era 2025. Dementia is a condition that can affect anyone at any time. Dementia is not caused by ancestral causes. Anyone who asserts that it is caused by ancestral causes, voodoo, or enemy-afflicted disease in Nigeria is either an illiterate, an imbecile, a manipulator, or a criminal that should be avoided. Don't be a jejun. My name is Abraham Bola Lawal. Thank you.